Namaste and greetings. I, Dipangshi, researcher at IMPRI, Impact and Policy Research Institute, Prabhav एवं नीति अनुसंधान संस्थान नई दिल्ली, extend my warmest welcome to you all to IMPRI Web Policy Learning. Today marks the inaugural day of Public Policy Qualitative Participatory Action Research Fieldwork Fellowship, Cohort 5.0, an online national winter and spring school program. A 5-month online immersive qualitative participatory action research fieldwork certificate training fellowship. To kick things off, let's begin with a concise overview of the program. PPQPARF 5.0 offers an in-depth, hands-on approach to understanding public policy challenges through qualitative participatory action research. Participants will engage in expert-led sessions that combine theory with practical applications. Workshops, networking forums, and group projects will equip participants with tools needed to navigate complex policy environments and address real-world issues. Cohort 5 encourage active participant engagement, fostering collaboration with peers and mentors to explore diverse perspectives and develop evidence-based solutions. The program curriculum covers essential components such as qualitative research, methods, fieldwork designs, research tool creation, interviews, focus group discussions, key informant interviews, and stakeholder mapping. Participants will gain practical experience in tool testing, fieldwork execution, and reporting. Additionally, the fellow places a strong emphasis on enhancing research writing and critical thinking skills. Participants are expected to conduct independent fieldwork in their research in their respective area, submitting detailed reports that reflect their finding and analysis. This program has an excellent panel of experts who will be sharing expertise for the duration of this program. The chair of this program is Professor Vibhuti Patel, visiting distinguished professor at IMPRI. The distinguished panel includes Professor Mukul Asher, Dr. Padma Deosthali, Dr. Amar Jesani, Dr. Purnima Chauhan, Professor N. Mani Mekallai, Professor Gumati Sridevi, Professor Utpal K. Dr. Soumyadeep Chattopadhyay, Dr. Prabhu Ponnaswamy, Mr. Arvind Unni, Dr. B. Rajeshwari, Dr. Anamika Priyadarshini, Professor Manjula Bharti. The conveners of the program are Dr. Simi Mehta and Dr. Arjun Kumar. Proceeding further, I heartily welcome you all to Public Policy Qualitative Participatory Action Research Fieldwork Fellowship, Cohort 5.0. Here, in this program, we come together to share a goal of advancing our understanding of public policy through rigorous qualitative research and participatory action. This journey we are embarking on today is not just about acquiring knowledge, but also about fostering a community of like-minded individuals passionate about making a difference in society. We have also shared the course outline and reading via email for your kind reference and perusal. Before we start today's session, I would like to announce the housekeeping rules. It is imperative that you join our meeting on time. There will be a Q&A session after each presentation. Share your question in the Q&A box and not in the chat box. The questions must not be posted as an anonymous attendee. Ensure that your questions are precise and refrain from making general comments and questions to save time. I would now invite our chair, Professor Vibhuti Patel, to deliver her opening remarks.
Yeah. Thank you, Dipangshi, for introducing the course. And first of all, I welcome today's keynote address speaker, Dr. Padma Deosthali, who has a very long journey on participatory action research, which has resulted in some of the extremely important transformative changes in our country regarding gender-based violence and other public health issues. Now, today, I would like to offer my heartfelt thanks to the conveners of this program, Dr. Simi Mehta and Dr. Arjun Kumar, and the whole team of coordinators, Vidita Jha, Vaishali Singh, Satyam Tripathi, Priyanka Negi, and Sweta Shankar. And today's moderator, Dipankshi, you are going to have a very important role for the seamless conduct of this session. This course has been very popular, and we take limited number of fellows. So many of them also get fellowships. We have reached cohort 5. That itself shows that there is a tremendous interest among the young scholars, aspirants for competitive exams, and also those who want to enter either in the field of non-government organizations or government bodies or various departments, UN system, human rights organizations. They are all interested in qualitative participatory action research to understand its vision, mission, goals, objectives, and the contribution that this methodology has made over last 7 decades. You can say immediately after Second World War. Earlier, it was used only for war purposes, but development sector has started using this methodology, and it involves communities affected by the research in collaborative and reflective process to understand and improve the world. It is not someone else. You are not, you have to own the research. You yourself have to get involved in it. It can't be done only through investigators. The goal of the participatory action research is to understand and improve the world, the community, the ecosystem around us, by changing it with the help of collective self-reflective inquiry, where all stakeholders have have to contribute for the construction of new knowledge. And it involves researchers and respondents in all stages of the research process. That is why we never call them research subject. They are the respondents. They are the equal stakeholders in this research. Dipankshi also told you that the course content and the various methodologies about will you will be acclimatized with and the fellowship offers the participants unique opportunity to delve into very important topics of policies, legislations, and some of the interventions by both the state and non-state actors for the transformative change. And you can choose the topic from varied areas of international, national, regional, local concerns regarding human rights or laws and policies, or constitutional laws or foreign policies, marginalized communities' rights for human development, social security, and social protection of the intersectionally vulnerable populations, issues of gender justice, environmental rights, disability rights. So they are through participatory action research, you can arrive at a collective understanding, and this knowledge, which is product of collective wisdom, can result into transformative policy. So in the previous 4 cohorts, some of the very important concerns which the fellows had taken up were digital divide or budgetary allocation of local self-government bodies, out-of-pocket health expenditure, public-private partnership, implementation of laws on gender-based violence, or preconception prenatal diagnostic techniques act, question of child labor, Skill India mission and its evaluation, the startup or the challenges faced by startup, challenges faced by women workers in mine sector or informal sector, environmental pollution, status of pension provisioning for elderly, understanding context of dowry related cases and the remedies, the assessment of Ujjwala Yojana, and also the Mudra Yojana, and also the teachers in the government colleges, government schools. So you must have seen some of the event outcome reports of previous 4 cohorts, and also the anthology that came out, edited volume. So it is a result-oriented approach of this course. So at the end of this course, you fellows will be coming up, we will be in contact, regular touch with you through email, through WhatsApp group that will be formed. Any dilemma, any problems that you have, you can discuss with them. We can also act as a facilitator while you are doing your field work. An IMPRI team is always there to this thing, and each one of you also will have a mentor who will you can be in touch with, so that from the stage of idea to the actual chapter which you come up with, there will be a lot of hand holding. So today we are beginning with the keynote address by Dr. Padma Deosthali, and over to IMPRI team.
Thank you, ma'am. for giving such a comprehensive and insightful overview of the program. Your detailed explanation has set a clear direction for our journey ahead and highlighted the immense value of this fellowship offers. With this, we now move on to participants' introductions. I kindly request each participant to introduce themselves by sharing their name, designation, organization, and the motivation or reason that prompted them to join this course. You may either raise your hand to volunteer, or I can call your on names one by one to ensure everyone has a chance to share. Let's proceed.
Starting.
Or, ma'am, we can have Padma ma'am's lecture first.
Yeah,
I'll-
okay, yeah.
Dipanshu, let us introduce Padma.
Yeah,
ma'am. Let's
okay.
have her introduction first.
Keynote address.
Many of people are still joining, so.
Yeah.
So I'm honored to invite Dr. Padma Deosthali, Senior Director, International Center for Research on Women, ICRW Asia, to deliver a keynote address.
Thank you, Dipangshi. Thank you, Professor Patel, for this opportunity. Hello, everyone. I believe that some of you are still joining in. Just wanted to say that the experience of, as Vibhuti said, whatever I'm here to share with you is based on my experience at Sehat, which is a research organization. I worked there for almost 16 years. And, having been involved in a range of research studies, the presentation that, I have prepared for you this Saturday is to build on our experience at Sehat on working at the level of policy and law to change the way the health system responds to violence against women. So, in ways in which qualitative research was applied. So those are some of the examples that I would like to share with you. And with that, may I start? Okay.
It's good.
Okay, thank you. So research refers to search for knowledge, and it's an inquiry. It's a search for new facts in any branch of knowledge. So that's research, and I think all of you, have that background. And it's really to remind ourselves to say that, whether it's participatory research, qualitative research, quantitative, the idea is to look for new facts. And the field may be any, it may be biomedical, it could be social sciences, but we are looking for new facts. When it comes to qualitative research, it's a phenomena relating to or involving quality or kind. So we are not focused so much about numbers, but more about the kind and the quality. It helps to understand and analyze various factors that motivate people to behave in a particular way. So why do people behave in a certain way, whether it is in terms of help seeking, but why is it that some people do something is an area that can be explored only through qualitative research. It reveals categories, concepts, or understanding that are internal to the group or the domain being studied. And research participants, as Vibhuti said, construct for the researcher their own understanding of the issues at hand. So they are not mere subjects who are being interviewed, but they are called research participants because they are participating in the research, and they, through their narrations, are helping the researcher understand the issue from the perspective of those who are experiencing it. So it's really bringing in lived experiences of research participants. That's the defining factor as far as qualitative research is concerned. What are the dimensions of qualitative research? So one is it's very useful in understanding context. And coming from a health background, qualitative research in health is very useful in terms of if we want to understand how economic, political, social, cultural, environmental, or organizational factors influence health. So in the, what are the current, we are all aware, say, for example, of what the health policy is or what are the macroeconomic policies, but how does that entire macro context affect or influence health? And as an example, I'll give where we all know about globalization. When it came in, the structural adjustment programs, and this is going back to the 90s, where globalization and structural adjustment programs were implicitly brought in, and the idea and expectation was that it's going to have a very positive impact across board. So it's going to benefit people. So all these changes which are happening at macro level are going to increase, say, the kind of jobs. Now we know it didn't, okay, but I'm talking about 90s. So it's a whole range of new kinds of work that were being created, and women were getting work. And it's going to open up and increase access to health. And these were some of the expectations with all these globalization, programs. And that's the time when Sehat conceptualized a study to really understand how is globalization affecting women, women's work, women's living environment, and how does that impact their health. And for that, we looked at three different contexts. One, a context of deindustrialization, which was in the city of Mumbai, which as you all know, the closing down of industries in India, in Mumbai, and the informalization that took place in the industrial sector. So we looked at how does that impact women's work and living environment and health. Second, we looked at globalization brought in certain kinds of industries which were, which got opportunities for export. So, for example, grape industry. So there was a whole massive export of grapes happening. So we tried to look at what has been the impact of these policies on the grape industry in terms of the way the grape cultivation takes place, and how does it affect the workers, the labor that is working in these grape farms. And the third we looked at was the impact on agriculture, where, a lot of labor that was engaged in agriculture was now moving to new kinds of, informal units, which were offering better pays. Working conditions were not known that time, but yes, a lot of young women and young girls were choosing to go to these informal sector rather than continuing work on the farms. And these were three case studies that were, investigated into, and it's been published as a book. You'll find it on the Sehat website. It's called, it's Women, Work and Environment, and impact of this on their health. And so this is just an example of how in the 90s, when we had very little macro data available to look at the impact, qualitative study or qualitative inquiry and bringing in people's experiences, women's experiences, became the only way to understand how these macro macro policies were affecting their day-to-day work, their health, and their living environments. So this is one way. The other is understanding people. Now, how people make sense of their experiences of health and disease. That's something that quantitative data gives us an information around utilization, expenditure. But how do people experience what's happening? So what are their experiences of seeking health services? How do they decide when to seek service, when not to? So if you look at quantitative data or NFHS data, you'll find that large number of, there's a gender difference in terms of no treatment taken. So, there is, do you have a health complaint? Yes. But when it comes to utilization, you will find that a large number of women as compared to men may be reporting that they have not sought any treatment. Now, why are women not seeking treatment is something that has been explored through qualitative research by health researchers to really understand how do women perceive their health. And it's to do with the nature of domestic work, reproductive care, the triple burden that women face, and how that impacts the perception of when or who in the household can actually spend money to seek health care. So a lot of issues that women face, which are aches and pains, which are rooted in the kind of triple burden that women have to face, often is neglected by women because they don't perceive that as to be serious. And a little rest and then going back to the same work is a coping mechanism that women have often reported. So understanding these perceptions, qualitative research becomes an important tool to unravel these kinds of experiences of health and disease. Or, for example, another study that Sehat did was to explore what is the experience of women, nature of discrimination that they face when they access health services. And there was a understanding, and our experience showed that health systems are prejudiced against Muslim women. So there's a lot of prejudice and ill treatment, disrespect that is meted out to Muslim women. And for that, we spoke to Muslim and non-Muslim women to really understand what are their experiences of accessing health services, public and private. How do they take a decision of which facility to go to, and what have they report, what is their experience? And women spoke about layers of discrimination. So they said, one, they were treated badly because they were women, because they were poor, and because they belonged to a certain community. And here we found that Muslim women reported being, discriminated, as well as women wearing parda who were, seen as migrants in Mumbai also reported, because they were seen as outsiders who were using these health services, who didn't have an entitlement to these services, and they reported this different. Now, these are experiences which are possible only through qualitative research inquiry, because that allows the researcher to really spend that time and create that kind of a rapport for research participants to be able to speak and share what their lived experiences are. The third is understanding interaction. So, if, one is understanding the context, people, but also how various actors involved in different public health activities interact with each other. So, whether it is different staff within a health facility or community health workers. So understanding how they interact with different stakeholders and the community also becomes an important area of inquiry. The limitations of qualitative research, as you all know, are generalizability, because often it is considered to be, you can only generalize it to the specific context within which the study has taken place. There's also another limitation of bias, because there is a tendency or a danger that as researchers, we may emphasize what we are looking for and ignore the rest. And the third limitation is reliability. So how reliable is this data? Because have you cooked it up, or, is it, your own things in your mind that you're speaking out as a researcher? But all these limitations can be circumvented And we can make the qualitative research extremely rigorous by different kinds of strategies. One is using representative sampling strategies. So even if our study is, say, based in Mumbai, ensure that it is the sampling is such that we have captured the narratives and voices of a diverse group in that particular area. Or it may be geographical, or it may be the category or community or group that we are researching. So making the sampling in qualitative research becomes important. As you all know, there is no formula for sampling. So it's till you get new knowledge. So it is nothing like 20, 25, 40, 50 interviews when you're doing an in-depth. But for in-depth inquiry, for in-depth interviews, how representative is your sample becomes very important. So have you looked at all different kinds of axes? So whether it is caste, class, religion, education, work status, migration, years of residence, all that matters in ensuring, in making your study and your research as rigorous. And there can be then no doubt about the fact that you're doing what is convenient. So it's not a convenient sample, but you make it as representative as possible, starting with specific research questions. So although there may be a broad inquiry, really breaking it down to say, okay, what is it that we are asking our respondents? That becomes very important. Standardizing by using a series of questions and probes. So we all know that in qualitative research, as a rule book, you can just go with a totally unstructured tool. But if you are able to break it down and ensure that you are using a standardized way in which you're speaking to everybody, the reliability of that information becomes solid. Using multiple and independent assessments during analysis. So, even if you're relying on qualitative, you can look at focus groups, in-depth interviews, participant observations. So really bring in different tools so that you're triangulating what you have, and it's more solid what we are presenting, and ensuring researchers are trained and skilled. Qualitative research requires, if I may say, more skill than any other method, because it is more challenging, and it is, in in the in-depth interview, your conversation, conversation skills have to be really honed, because otherwise it can just become a question answer thing, which is not an in-depth interview. Then it is like any other interview. So if we want to really get into the person's lives and the perceptions, their reasons, their past, how do they kind of make decisions, their relationships, it's important that we have conversation skills, and therefore, and those need to be learned. That's not something that always our education system gives us. Now I'll move into some examples specifically on gender-based violence. And these are examples that I've picked up more, a little different from what our usual perception of participatory research is, which is often community-based. We are involving groups, etc., which I think, the course has a range of experts who are going to be talking about it, and I've read the reports of the earlier cohorts. These examples are more in terms of seeing how qualitative research was applied by Sehat as an institution to work with a health system and with survivors. So it's both, it's about the system that needed to change, at the same time bringing in survivor perspectives to really understand what's happening. So it's, I hope you find them useful. My email ID is available, and any further details or reports you would like to receive, I'm happy to share. The first one I would share is in participatory research, formative research is something that is become very common. And I think I'm proud to say that one of the first organizations to use it very constructively and really well was Sehat way back in 2000, where we were tasked with the responsibility of setting up a public hospital-based crisis center. We knew that it's important, but we did not know how a hospital system really functions and how the system would even respond, or we didn't know how really we wanted to set it up, or what were the opportunities and how to make make use of the entire system more effectively, so that we are able to create such a service for survivors of domestic violence. And for that, we used three methods. One was we used observation, participant observation in the emergency ward of the hospital that we were assigned to work with. Here we spent about 15 days, uh, early morning to late night. A researcher just sat there to just observe what was happening at the emergency ward. Who's coming in, who's going, what are the kinds of interactions that take place. There's a whole range of patients who come in. So really focusing on the patients who were suspected cases of domestic violence. So either they reported assaults by family members, or women who came with, organophosphorus poisoning or burns. So these were the medico-legal cases of women who clearly were suspected cases of domestic violence. So we spent these 15 days. So that was one method. Second was we conducted in-depth interviews with hospital staff of all categories, from doctors to the ward boys and ayabais, to really understand what was their perception about domestic violence, because we had to work with this hospital for the next 3 years, and we really needed to know what was the ecosystem within which we were trying to bring about change. The third was review of medical records. So really, content analysis of the medical records that were preserved by the hospital, especially the medico-legal, to understand what is being written, etc. What we found was that, through the observation, we found that the attitudes of staff to domestic violence cases was really poor. They thought these were all non-severe cases, or they were wasting their time because they were quarreling at home and coming here. Even with cases of suicide, there was this feeling that, one sip of insecticide doesn't kill anybody. So it's such a burden. You're just creating burden for the hospital by coming here, and you really don't, you had no intention to harm. You're just seeking attention from your family. So waste of time. We also observed how the family interacted, the police, the health staff, and also the kind of time taken for every case. The in-depth interviews with healthcare providers helped us understand that across the board, whether it was a MD, MS, or a ward boy, the perceptions about domestic violence were very similar. They normalized domestic violence. So there was this feeling that it is part and parcel of a married life. It's not something that a health system or it's not a health issue. It's a law and order problem. There was a lot of victim blaming across board, that if women are being beaten, they must have done something wrong. So that was a very strong perception. There were also biases. This happens in certain communities, certain, whether they are poor or Muslims. So it's only happening in those communities. Otherwise, it doesn't happen in other housing societies. The medical record analysis also showed us what gets recorded and what does not. And even today, when I look back, this was done in 2000. I think this really helped us design the intervention for this hospital, because we were able to really understand whom we were working with and what we needed to change. So in that sense, there was no other way. After 20 years of working in the sector, I don't think there was any, we could have really established a crisis center without getting into the nitty-gritties of how people, just telling people that this is the law and you have to do it, we know does not work. And I think the reason that that center worked and has been there since for last 25 years is that we were able to really not use the stick, but really change people's perception and attitudes towards domestic violence. The other was also, having established this center called Dilasa, we also carried out a study to understand how were survivors perceiving this hospital-based crisis center. So, did they find something like a space like Dilasa in a tertiary hospital really welcoming, or was it overwhelming? Was it intimidating? I mean, we had a lot of thoughts, and it's towards the end of 3 years that we carried out this study, and it brought in, again, of course, the sampling, as I said, was done rigorously. We spoke to women who were currently living in non-violent relationships, women who were currently seeking services of the center. And third, we also spoke to women who never came back to Dilasa after their first visit. So we had a range of experiences. What women said was that their feelings and experiences were validated by the counselors. They found this space to be safe, comfortable, and confidential space where they could, speak out, unthreatening it was. They were able to understand that what was happening in their lives was affecting their health. I think that was also one of the crucial reasons why Dilasa was set up, to really also look at it as a health issue, and the fact that violence and health is so interrelated. Uh, they also said that in increased belief that women are not to blame. So, this whole thing about it's not your fault that this has happened had reached them. Of course, one of the concerns that they raised in those interviews were that while safety plans were made, they were not always effective, because the circumstances, the situations that they lived in were challenging, but they knew that they could save themselves. They knew that this is not something to be accepted as fate, but to question it and stop what's happening in their lives. So the reason I'm putting this out as an example for you is to say that we start an implementation. We also need to bring in the user perspective, and in this case it was the survivors who are the users of this crisis center, to really see whether what we think, all of us, based on our understanding, our intelligence, evidence, we may think that this implementation is extremely useful, very important. But user perspective is very important to bring in, so that we are able to also make changes and refine or improve the kind of work that we are doing. Sorry. Last example that I have is of a study that was done where 66 survivors of sexual violence were interviewed by the Sehat team to really understand what is the impact on survivors and families, to really go beyond this whole issue of whether women, whether there's a conviction or not conviction. That's how the whole rape discourse in this country goes. It's criminalized, and then whether if there was a punishment, there was a conviction, then it's true. If it's not, then it's a whole range of questions being posed of whether it's a false case. Of course, we all know that all those who are not convicted are not false cases, because there may be poor investigations, but it's all related to the way the system works. We don't have a human face to it. How does a survivor, and is it only the survivor, how does it affect the family of the survivor? What we found, and through these interviews, I just don't have the time to go into detail, but report is there for you to access. Unfriendly, intimidating, and hostile institutions was an experience that was shared across. And when I say unfriendly, intimidating, hostile institutions, these are institutions of the police, the court, and health. And this was compounded by isolation, humiliation, and hostility from the community. So many of them spoke about how immediately after the FIR was filed and they went back home, their entire community had taken a decision to ask them to relocate, leave that area, because they looked at it as something that, the police will keep coming to this building or to this slum, and it's going to only create a lot of harassment. And they were asked to, move out. So there was isolation, there was humiliation, and there was a lot of hostility from the community. Many of them who could not move because, for relocation, you need some resources. There, they have been completely isolated. So there's been also ostracization. It's not just isolation, but it's ostracization. So not inviting them home for any function, within, by other households as well as in community functions. Parents had to give up or change jobs because this continuous follow-up required parents to accompany the survivor, for either to the police or the health or to the courts. And just as an example, I mean, we had a father who was a driver in Air India, and he had to give up a permanent job to pursue the case. And he became like this, a daily, on-call driver. So these were, another mother was asked to leave the job because the incident had taken place at her workplace. So, it's not just the survivor, but the parents also, have this have various kinds of setbacks. Children, we spoke to children, there was absolutely no discussion about the incident at home or with other children or with family members. The perception that if you talk about it, the child will not forget. But, having to continuously go back to court, the child is anyways not forgetting the incident. But, the family doesn't talk about it. They hope that the child will forget. Parents' health was affected. There was loss of weight reported by the parents, diabetes, BP, heart attack, even mental illness. So a whole range of health complaints that were reported by parents. And as far as survivors were concerned, a large number of them spoke about suicidal ideation, attempted suicide, untreated reproductive health problems, because after that first medical legal examination, they never went back because, that experience was so negative, or they were just scared. They just didn't want to go back. So untreated reproductive health problems that continued. There was fear, numbing, becoming a loner, lack of sleep, aches and pains, many other health problems. So, and many of these, all of them were had come to the health system where there was a crisis center, but none of them followed up for health. So the whole focus of the medical legal was only for that moment to find out whether there was any kind of health issue at that point. Otherwise, there was absolutely no concern about how it would affect them in future. This is, this is my last case study, kind of example that I'm sharing, which is Sehat's evidence-based approach to looking at influencing law and policy on health sector response to sexual violence, and how we used qualitative research to really impact, law as well as policy. So very quickly, the gaps in medical legal response to sexual violence that were identified by Sehat through a qualitative intervention where 20 survivors who reported to 3 tertiary hospitals, we very closely observed what happened with each one of them. So at the moment they reached the hospital, there was a researcher from Sehat who came to the hospital and assisted that entire medico-legal, process. What we found was there was insistence on police complaint. So it was not, they were not immediately given health treatment. Even if they were bleeding, even in severe cases, they kept waiting for the police complaint. There was preoccupation with injuries. There was a perception that if there was no injury, there was no rape. There was a whole focus on past sexual history and, commenting on the hymen, the presence or absence of hymen, commenting on the size of the vaginal introitus. And the entire examination was mechanical. So even if the survivor was saying that I was not touched below my chest, they would go ahead and take a vaginal and anal swab because it was more defensive practice. So it was just to say that I have not missed out something. So they were just mindlessly, mechanically examining. There was an absence of reasoned medical opinion. So there was no clinical opinion being given in any of these medical legal pro formas. They would just carry out all of these swabs and say awaiting lab report or something like that. Therapeutic needs were completely neglected. So we had many in these 20 cases. We also, when we were following up, we found that unless the researcher intervened, the Sehat researcher, a pregnancy test was not carried out. So you know what happens if you don't do it in time, then the survivor may come back for an abortion, which could have been easily prevented if a test was done and she was given an emergency pill. As an approach, as an action that was taken by Sehat, there were different strategies. One was involving health professionals themselves, because we knew that this criticism about the way the health system is responding uh, is historic. It's from the Mathura rape case that this kind of how do I say, this criticism and the unscientific aspects of the medical response was raised by the feminist movement, but there was no change. And therefore, we felt that it was important to involve health professionals. So we got a petition, a statement was issued, more than 100 healthcare professionals signed it against the two-finger test to really kind of, it's not just the civil society and feminists who are shaming health professionals, but to say that there are health professionals who also, stand by the feminist movement and call it out and say that this is absolutely unscientific and archaic. We also involved health professionals in presenting such papers in different fora, in medical conferences, to really kind of get the health sector to constantly talk about it. For legal and policy advocacy, we were very, we ensured that we have technical inputs from experts. We also brought in a technical opinion from the World Health Organization. We intervened at the court. So we actually filed a PIL in Nagpur High Court, which we lost, but we appealed in Supreme Court, and later on, the changes did come in. And we also used, effectively the mass media and, making submissions to the Justice Verma Committee, meeting authors of popular medical textbooks, especially the forensic textbook, to appeal to them and their minds about the unscientific nature of the content of these medical textbooks. We were able to make some good impact in terms of, as you will see, the legal changes that came in, recognizing all forms of sexual violence. This whole perception that rape is only penetrative sexual intercourse, peno-vaginal penetrative intercourse, was broken through a lot of this analysis that we were able to bring, that survivors are reporting non-penetrative sexual assault also. And the nature of examination, the nature of medical evidence is going to completely change when you have a different kind of sexual assault. The fact that survivors of rape have a right to health, They're not just coming to hospitals for their evidence to be collected from their bodies, but they also have, a right to treatment, making redundant the preoccupation with injuries. So all of this we saw finally translated into the changes in law in 2013. Also the stopping of all the insensitive and unscientific practices, and bringing in victim compensation. To say that it's not just about filing a case, but the person needs to be compensated, and that victim compensation must start immediately as soon as the case is registered. Along with it, we were also able to bring about some policy changes because the law brought in right to treatment, but it also said mandatory reporting to the police, which was a big barrier in provision of treatment in the first place. And therefore, at the policy level, we were able to bring in the concept of informed consent and informed refusal. So if I just want treatment, then just give me treatment. And I refuse that for any further reporting to the police, etc. And that has to be respected. Of course, as when it comes to anybody less than 18, it's still an area of concern. But at least for 18 and above, we were able to establish that. Demystifying medical evidence. So the policy guidelines of the Ministry of Health clearly spoke about collecting relevant evidence, not mechanical evidence. So going with the history and provision, collecting evidence accordingly. Provision of psychological care also became part of the policy changes, and the need to give a reasoned medical opinion. So I'll stop here.
Thank you, ma'am, for your comprehensive and engaging talk with us. I now invite Vibhuti ma'am for her remarks.
Ma'am, you're muted.
So Dr. Padma Devasthali, you have brought out very important dimensions of the qualitative research processes, and how the participatory research, non-threatening environment, informed consent, and ethical conduct, and no harm to to the respondent are very, very important feature. I just wanted to know that you talked about the Sehat's intervention and the Dilasa model getting institutionalized. Now, this at what level the upscaling has happened and replication has happened of this model? And for that, what all you had to do?
Yeah. So yes, thanks Vibhuti for that question. So this continued. So it's not an end to one demonstration in one hospital that I spoke about in 2000. It was then strategically replicated in different settings: primary setting, tertiary settings, secondary settings, to establish that yes, this model works. It's not just that it's happened in Bombay because Sehat. There was the perception that because Sehat is in Bombay, it worked in Bombay, it cannot work anywhere else. So it was replicated, and now it's been upscaled as part of National Health Mission. So it's functional in more than 6 states of India, and it's running in these 6 states in many district hospitals. And even in Mumbai now, all peripheral hospitals have a crisis intervention center.
And what about the budget? Who gives?
Yeah, so the entire budget comes through the National Health Mission. So there's no NGO involved there. So it's neither are the services contracted out. So the entire team of counselors, data operators, their salaries, the running cost of that intervention department is coming through the NHM budget in these 6 states. So we've not reached across India. But yes, I think 6 states have clearly taken it on board and included it into the budget. As you rightly pointed out, that becomes the test of any upscaling, because if there's no money, no such upscaled activity can sustain.
It's a centrally sponsored scheme where union government and the state government both
Yes.
contribute.
Yes.
So
yes.
that means that other states are not ready to give their own
So
share.
far, yes.
Six states are
Yeah.
ready to give their own share.
Yeah.
Very important. But the union territories can have, no, they get 100% from center.
They should.
They should. So
They
it's a
should.
question of political will. It's
Yeah.
not only money for
No.
because that they come under central schemes.
Yes, absolutely.
Dipangshi
You are
is muted.
Thank you, ma'am, for your remarks. Participants can now put their questions in Q&A box or raise their hands.
Hello. You can even share your experiences. Hello.
No one has raised any question, ma'am, so far.
The issue is new to them. That is also possible. So you can ask about either research methodology or the issue or any other issue on which qualitative research has been done or conducted or you know of or you have done yourself.
Ma'am, there are some questions in the Q&A box.
Okay.
Hmm.
Yeah. Suraj Goswami, please go ahead. Sujay Chaudhary, will the slides be shared with the participants? Suraj
Should I
Goswami,
read out
can
the
you explain
question?
it? But it doesn't explain anything. They need to explain themselves. Yeah. So find there. Hello, Suraj Goswami, where are you? You are there. You are unmuted. You can speak now. Hello? Hello? What do you mean by 10%?
10% of population, you're saying.
But that is the NFHS and NSS and all metadata, like government data. Here we are talking about qualitative research. So Padma, you can explain that in qualitative research. I think as you said earlier.
So thanks, Suraj, for this question, or maybe you're asserting that sampling should be 10%, but we are talking about qualitative participatory action research and not our general quantitative surveys, and therefore those kinds of thumb rule, whether it should be 10% or sometimes you'll find they also say 25% of the community, the population that needs to be included in any survey for it to be representative. Here we are not going by numbers. That's the thing. Here, your research question will inform your sample. So what is the kind of inquiry that you're holding? And do you have an adequate representation in terms of experiences? So if you're suppose trying to capture change, what are the changes? Then for that, we have to ensure that you have participation of research participants, respondents who are new to the area, who have been there for a long time, and with range of different things. So those who are working, not working, those who are educated, not educated, different age. So, we need to have older people because experiences. So that's the kind of matrix that one needs to create to be able to ensure that you have a wider representation. So that's where sampling in qualitative research is. So it's not defined by any percentage or number. I hope I have clarified to you, Suraj.
There is one
Shobana
more question, ma'am, in the chat box by Shobona ji. Shobona ji, would you like to please unmute yourself and ask your question?
Shobana.
Hello.
Hello. Yeah.
Good
Yes, ma'am,
evening.
you're audible.
Yeah, ma'am,
Yes.
actually, you said about, being more interactive with your participants or the respondents who you know, take to the questions to. And when we did research, like in my experience, they tend to get more hostile, or they feel that, you're getting too intrusive, you're getting too personal. Like, why do we need to share these things with you? Like,
Yeah.
at the end of the day, you're just a researcher. Like, why do we need to trust you? So building this trust takes a lot of time,
Right.
and researchers are very time framed. Like, how do we tackle that, ma'am? Because it
Yeah.
really affects the outcome.
No, you said it and you answered it, Shobna, in a way. So yes, trust, building a rapport, creating faith that what is being done without giving any false promises,
Yeah.
that it is being done with what is the intent of this study, for the study. So is it only for my academic interest, or I also mean some business? So
Okay.
that's the kind of rapport and faith that we have to be able to create. And yes, if they find it intrusive, we have to just stop.
Yeah.
Yeah.
And mostly in
I mean,
academic
there's no
sectors,
other way, and there's nothing that we should be doing which is intrusive at all.
yeah,
Like, they have to be part of the process and volunteer this information. And
exactly.
if we are kind of constantly asking, there's a problem. And, probably as a researcher, it's a point for us to reflect and stop.
In academic sections and sectors, we can't promise them much. It's just for our academic purpose we do it, but they expect some kind of, help or some kind of things in return from us. And as academicians or researchers, we fail to give them that. So in turn, it directly affects their responses to the questions. They feel that, मैं क्यों बोलूं, क्या
Mm.
फर्क पड़ जाएगा types. So it's really
Yeah.
a challenge, ma'am, when we go to the field and talk to them and try to get their responses, their ideas. They feel that, how many times should I say these things? Like, why should I tell you?
Yeah, I would just say that it's our responsibility as researchers to know what our limits are. So, of course,
Yeah.
we cannot provide everything, but we can keep all that information ready with us. That does not take a lot. It takes effort, but it is not so difficult. So, we cannot provide everything, but we can have all that information with us, and we can tell them that, okay, I can't solve this. I'll find out and I'll come back to you. So,
Yes.
that's how it has helped me at least. And I have always gone back with either the name of an organization that can help. So, simple thing, working in health, the first thing that they'll ask is for medical, financial support. And
Yes.
what helps is to have this list of organizations that do provide financial aid, and just keep it ready. Same as when you're researching violence against women, we have to be prepared that there would be support required. So just, take that, that becomes part of our preparation before we go to field, and keep that information ready, because we are taking so much from them, and if they have some expectations, I feel it's our responsibility to do the best, and at least provide them with numbers, information that they can seek. It's their right as research respondents.
Thank you, ma'am. Thank you.
And we have some more question by
There another
Rashid.
question by Prashik.
Rashid, Harun.
Okay, I read your question, Prashik. So these centers have over, on an average, every year there are at least 200 to 250 new women who are registering in these centers, and almost 70% of those who are registered follow up for some kind of service, and that is being, monitored. Also, the kind of services that are being provided are monitored rigorously through case presentations, where there are experts who come in to discuss challenging cases, so that the counselors, are reflective about what they are doing. And it doesn't become like like very prescriptive kind of response to every survivor. So all those things are in place. In terms of whether we have changed any policy, etc., I think feedback is taken, and some of it, initially when we started, we were not speaking to the abuser and their families. And it's over the years when survivors said that no, women started bringing their abuser in their second trip. So we had to really gear up and train ourselves to deal with abusers and their families with a feminist perspective. So when we started, I must say that we started with feminist counseling principles, and we said no, we will only deal with the survivor. But it's survivors who made us understand that it's not enough. Sometime, so joint meetings is again a intervention that is carried out by Dilasa, which I would say came from survivors' expectations, where we learned to bring in the abuser and their families and create a non-threatening environment where violence was questioned, and there was a commitment by everybody sitting in that joint meeting to say that whatever may be the differences or disagreements, violence will not be used.
Padma, one more question is that how the Lhasa experience translated into the law, which is Protection of Women in Domestic Violence Act, because none of the other laws talk about the role of service provider. This is the one law which talks about service product. So to what extent qualitative research helped in making such a comprehensive law?
So Dilasa is one, and of course, all the experiences by autonomous women's groups who are dealing with survivors of domestic violence, where the common experience was that women were coming forward, reporting domestic violence. They wanted help, but they did not want the husband to be arrested. They didn't want because what happens in India, and it's been documented well, is that moment the husband gets arrested, he's going to get bail at some point and come back. But because she has gone to the police station and reported something happening within her home, she is immediately thrown out of the marital home. So women were were being thrown out. They were shelterless. They were forced to either be on their own, or they had to go back to their natal families, who of course did not welcome them back. And so arrest was not what women wanted. Women only wanted violence to stop in their domestic homes. So that was one very important learning from the feminist movement, which has been translated into a civil law for domestic violence. So that is one. Second, I think the Dilasa experience comes in where the definition of domestic violence itself in the PWDVA brings in health. And it's the first time that any form of violence has been defined in law to say that any kind of, any form, any act which affects the physical and mental health. So I think that is very important, and I believe that the work around violence, domestic violence as a public health issue, has informed that framing within the domestic violence law. Also, the forms of violence have been defined. So, as you know, with the whole work on, against sex determination and prenatal sex determination, the domestic violence is the first law which says forcing a woman to produce a son is a form of emotional violence, which was never defined in the past. So
that can also transition into physical violence.
Right. So
Bruno.
There's another question in the chat box.
Okay.
Bruno wants to ask.
Bruno Richardson.
Yes. Am I audible?
Yes, sir.
Yeah. So hello, madam. So I just want to quickly ask about the sampling strategies actually. So when you start the session, you are also mentioning about understanding the context, the people, and about the environment they're setting. So previously I was also trying to work on something related to the understanding about the workplace harassment.
Yeah.
So maybe for workplace harassment, but even with the organized sector, they still have some kind of a setup. They have factories, companies. So it's kind of like a very similar study. But when we want to understand about the unorganized sector, it's a vast strategy. It's like maybe
Yeah.
a domestic worker works in a different environment, like a street vendor has a very different environment. So when we try to finalize some samples or want to understand how the harassment at their workplace, so do you think like we should be interacting with have a some kind of strategy for finalizing our sample, or is it like randomly we interact with different types of unorganized? Because some kind of work might be very that I don't want to like generalize this, like, but some kind of work where there might be less chance of harassment, but there in some kind of other type of work, like there's a possibilities of high harassment. So when we try to focus on the other part, like we might also end up saying that there is not much harassment in the normal sector. So how do we inclusively bring everyone, or like how do we create a strategy?
Yeah. Yeah. So I think to begin with, mapping, whichever geographical area you're working in, mapping the different nature of unorganized work in that area would be very useful. The mapping is not just listing. Okay, when I say mapping, get into the a little more details about the organization of that work. So whether it is domestic work, whether it is sanitation work, I mean, there could be different unorganized waste pickers. So जो भी है, just try and understand the nature or the way that particular kind of work is organized. That will give you an idea of the dynamics, like who are the people that the worker is interacting with, and therefore the question that you have, what are the kinds of people that the woman may be interacting with? What are the possibilities of abuse? What are the kinds of power hierarchies that she has to deal with on a daily basis? So that will give you some idea, that mapping. And then depending on your resources time, you can decide whether you want to look at one sector, you want to look at multiple, you want to look at 3 or 4. So you may map, say, 15 in that area, but you may choose to only focus on 3. And you will have to say why those 3. Okay. So that, I hope that is useful. But
Yes.
I mean, yeah.
Thanks.
When we go as a stranger, and when we go as a person who already has something to do, and the credential of that person are positively reviewed by the respondent, does it make major difference in qualitative research?
It can, and I think one has to be aware of our positionality, which is very important, and then either clearly, explicitly state that positionality, and then or kind of choose a different area of inquiry. But I think first is to just acknowledge that positionality and be aware of that, and see how you can reduce the bias that comes from that positionality.
Ma'am, we have one more question by Janvi in the Q&A box. Janvi ji, would you like to unmute yourself and speak?
I'm unable to. Okay, yeah. How do you show that your qualitative data is reliable when presenting? So there are different ways, Janvi, in which you do that. One is the rigor with which you have selected your sample, the rigor with which you have analyzed your data. So all of that becomes critical to how reliable and scientific the study is seen. So it's no one way. There's no like it's a whole range of things that need to be followed to prove that what we are doing, what we have done is scientific and it's not from our imagination. Even simple example, like if we have taken an interview in Hindi, you transcribe the best, the most rigorous way is to transcribe it in Hindi and then translate it in English. Often we assume that we have taken this data, so from Hindi we directly translate it in English. Even if you do that for any reason, ensure that someone else is listening in and checking your transcript. So these become important parts of your methodology, which shows the rigor that you have followed in your entire research process.
One more question. By Sujoy Chaudhary.
Are transcripts always necessary for evidence? What do you mean? Transcripts are necessary for analysis to begin with, Sujoy.
Yes.
Yeah, so they are important for analysis, because otherwise you know an in-depth interview would be about 45 minutes on an average. So you can't remember all of it. So you need to transcribe it, and then through we didn't have time to discuss ways of analysis in qualitative research, but that's part of the course. Then you analyze those transcripts. So those transcripts are never published, right? That's your data.
Okay, that was my question. I mean, do
Yeah.
we need to also, have the transcripts as annexures, maybe?
No.
Okay. Thank you.
Yeah.
One more question by Kinori Sinha.
Kinoriji, would you like to
Should I
unmute
read the question?
yourself and ask the question?
Is it always necessary to take help of an NGO, especially for marginalized forest dwellers, and how to select such NGOs whose ethos will align with us? So there is no fixed rule that you have to necessarily go with an NGO. If you go with an NGO which aligns with your perspective and thought process, it creates an enabling environment for you to carry out research. Because otherwise, for you to build rapport will be much longer, as somebody had initially asked. So if you do know somebody, NGO or any other, even it could be a government facility also, it's good to align if they are willing to support you in your research without interfering or without becoming gatekeepers. That's the main thing. Then I think it helps. Yeah. Is there any scope for change in POXO Act being a policy researchers? Oh my God. Well, it's been reviewed, and it's this whole aspect of mandatory reporting. Three of us, along with a doctor and a expert in child sexual, who's a victim advocate, we made a written submission, but the committee reviewing it did not consider it. So yeah. Yes, it is the same method followed in grounded theory research.
But about POXO Act, at least
Yeah.
that mandatory report about which I think modifications have come.
They have not, Supreme Court has taken cognizance in cases of abortion, but not in general. So it's like they have said that, okay, if somebody who's been sexually abused comes to you, you must provide abortion immediately. That's all that the Supreme Court says. But it does not say that, and it also asks doctors to keep the name confidential. Yeah. So Prashik, yeah, no good news on that front. But I would say that, that having worked for so many years, we have to continue to bring this to fore and, give these examples, produce this evidence. At some point, things will change. So it's not lost battle or a sad situation. We have to just take it as a challenge that means that particular mindset is so difficult to change.
For change, we can have three approaches. No, top down, like a person like Justice Verma, who has a mandated power and takes right position.
Yeah.
Laterally, like survivors themselves come together. And third is a pressure from
Yes.
below.
Yeah. Thanks for that.
Thank you, Dr. Padma, for an enlightening session, and we hope to see you in future IMPRI events.
Thank you so much
I
for
would
this opportunity.
now like to hand over. Thank you, ma'am. I would now
Thank
like
you,
to hand
Padma.
over
Such
to
a
Ms.
lively
Sana
session.
Ansari. I would now like to hand over to Ms. Sana Ansari to take us through the guidelines document.
So, a very good afternoon to our experts and all the fellows present here. So, today I will be discussing the various components of the fellowship that are required to be fulfilled. So, as a part of this fellowship, these guideline documents will be shared with all the fellows by email and along with the video link email that usually goes after each presentation. And we have incorporated the various documents and various important components of the fellowship in this guidelines document, which include the details of the event reports at the start, which you can see the about section, and it also provide you with the previous cohort information, the collection of essays and event outcome reports. The collection of essays are particularly the essays written by our past fellows, and the current fellows are also going to submit as per the essays as per this part of this fellowship program. So for your reference, the link is provided so you can access the essays to understand the various type of topics that have been covered and the structure of the papers as well. It also outlines the various details of the fellowship, such as the list of the experts that are going to be uh, engaged during the course of this fellowship. My previous one. So yeah, so there is a list of the experts that are going to engage during the course of this fellowship. And next, ma'am, please. So the program structure is also given for your reference. So in the structure of the program, there are timeline mentioned to make the fellows understand when you all are supposed to submit the abstract, the research essays, and the PPTs that the fellows are going to present as a part of the research essays. Next, ma'am. So moving forward to the creative project part. So there are various components of the creative projects, and it's mentioned here, for example, the time limit for the PPT presentation as part of the fellowship research essay. So at the end of this, you will going to present the outcomes of your research essays in 3 to 4 minutes in PPT slides, or it can be audio visual, or it can be storytelling as well. It's okay. The creative mode in which the fellows are comfortable is acceptable, and the guidelines are laid down in the document itself. You can have a look. Moving forward to abstract submission. Yeah, thank you. So the abstract submission guidelines are also provided here, such as the length of the abstract that is supposed to be submitted, the date in which it is supposed to be submitted. So here we have February 6, 2025 as a deadline for your submission of your abstract. Moving forward to the timeline. Yes, thank you. So in this guidelines document itself, you can see there's a separate section where a detailed outline and the timeline is provided for various essential components. That's going to be like the abstract submission or the project selection or the project update interaction, which will include Vibhuti ma'am, of course, and the other experts that are going to engage to help you with your research journey in refining your topic or in the selection as well. So there will be various interactive sessions to give you more support and assistance in drafting your research paper and also at different stages of your research journey, be it your research, literature review or data collection, etc. We have also have the important dates here, such as the PPT presentation, the draft essay submission, or the final research essay submission. Moving forward, so there is the project highlights are also mentioned here. We have also laid down the various research guidelines. Yes, thank you, ma'am, which include the various research stages. We have also provided you with the understanding of various methodology that you're going to be using in your research journey. Moving forward to the style guidelines. So, yes. Yes, so IMPRI follows the APA citation and it also provides the various style guidelines as mentioned that you are supposed to write, how you're supposed to write the dates, numbers, spellings, language, and everything is mentioned here. So kindly have a look, and we have also mentioned and provided the reference how APA style is written. So kindly have a look. Moving forward to AI skills. So as part of our essay submission, we have also provided you with a list of AI use for researchers, especially with respect to the literature mapping. So we have also let down the list of all those AI tools that researcher can take support while conducting or writing their research papers. A layout of research is also there. Like we have also have the plagiarism checker as well. So fellows are expected to submit the report along with the research essays, and the layout of the research is also given, where it is clearly mentioned that the research word limit should be from 3,000 to 4,000, and other various components are also mentioned. Uh, Moving forward now. So here there's various other important components such as ethics, about publication that you can read uh, on your own. Moving forward to the reading resources. Yeah, thank you. So at the end, we have our reading resources that experts have shared with us as a part of the course of this fellowship. And we have also provided you with a list of those here under the reading resources title. So after each session, they are going to share their reading resources or PPT with us, and we are going to keep adding that. And that all those going to be shared with you along with the video link in your email. Uh, um, and also, apart from this, there's one important announcement. So, to facilitate information, ensure that fellows stay updated, a WhatsApp group will be created, and this group will serve as a platform for easy interaction and will provide reminders about important deadlines and updates related to the fellowship. And we hope that you will thoroughly review the guidelines documents to know about all the aspects of the fellowship. And if you have any question or need clarification, please feel free to reach out to us through WhatsApp group or email us at learning@impri@gmail.com. Thank you so much for your attention, and we look forward to supporting you in this journey and in this unreaching fellowship journey as well. Thank you, ma'am. This guideline document will be provided to you via email. So there you can access the document.
As we come to the end of day one of public policy
Dipankshi,
qualitative,
hold on. Yeah, just a second. Yes, we have created the WhatsApp group for all the participants. Those who have not joined, we'll also share the link of the group via email along with other necessary documents. Since we didn't get to have the participants' introduction in the starting of the program, I will request all of the participants to kindly unmute themselves and give us a brief bio, like your name, your organization, and also what is your interest area. And since most of you have submitted some form of abstract already, maybe you can shed some light on that as well. Professor Vibhuti Patel is our chair for the program, so this is a good point to introduce yourselves with her as well. So just raise your hand and we'll take your names and we can go from there. Yes, Sita ji, please go ahead.
Hi, can you hear me?
Yes.
Yeah, so this is Sita Mahalakshmi. I'm currently uh, registered as a PhD scholar with School of Planning and Architecture, Vijayawada. I'm from an architecture background. However, I've done my specialization in sustainable architecture, more into green building ratings. Recently ventured into policy initiatives. I've been working on policy initiatives, GOs, and amendments for the past 5 years. but very focusedly for the past 1.5 years, I've been working on the policy of EV with Telangana. So, though I don't have a see, my intention for joining this cohort is to have a focused and directive learning towards policy framing and understanding, so I could proceed further very efficiently in the work that I am doing. And also, being a research scholar, these sessions I hope will help me through my research as well.
You
Could
have
you
also
also
like decided your topic too. Hello, Sita Lakshmi ji.
I think we lost her.
Yes, I'm back. There was some issue between. Sorry, did I miss something? Hello?
Yes, kindly point, like if you could just mention what is your uh, like what's the tentative title of your research? It does not have to be a confirmed one, but something that you're interested in, that would be good.
Yeah, I'm trying to work on service models in India, because there are a few service models already there in abroad, maybe 30, 32 countries. So I'm trying to work if do a feasibility study of these service models in India, which could reduce the load on institutional administrative bodies like state or central governments, and then increase community engagement.
So service body specifically in which sector?
Service exchange models in providing support to society in terms of not financially or economically. It's more of hourly basis service exchange models.
Yeah.
Thank you very much.
Thank you. So Joyji, you can go next.
Good afternoon. Uh, um, I'm from a non-profit background, and we are working with communities who are vulnerable to environmental hazards as well as climate change threats. And our work is essentially directed at getting the science, and there are different policies of the government of India. And however, there isn't the connect between the science and the policy and society. So we are trying to see, strengthen that interface, and particularly with respect to climate change. And, so this, uh, I took this course to understand how, communities perceive, the policies, government policies, and how we can look to strengthen that part of, the connect, actually. So we would probably, I guess, just tentative, I'm still thinking about it, is water and sanitation as a fundamental right. I mean, and why communities are still excluded from access, to safe sanitation, clean drinking water. So that's something that I would like to perhaps take up as a research subject. Thank you.
Thank you, Sujoyji. Ma'am, do you have any comments on this, or should we proceed to the next one?
Are you familiar with the literature on the subject?
To a certain extent, yes. I think, we have been doing mostly quantitative surveys. So, qualitative surveys. I wanted to get into a course and go through the technicalities of it, so that the research would be, how should I put it, correct. I mean,
Yeah.
So, thank you.
Thank you, Sujoyji. Next, Shiv Shakti ji, you can go ahead.
Good evening, ma'am. Thank you for giving me an opportunity to attend and enroll for this course. This is entirely new course for me, and I am well versed with quantitative kind of research activities. As I'm from medical background, I have done MD in community medicine after my MBBS, and then I'm serving in government sector in public health department, and my role is to implement the various public health interventions across the population in my district. But as I try to implement many of the problems and many of the interventions to reduce various childhood diseases, I come across that there are various contextual nuances which are affecting the implementation. That I don't know why there are some dates increasing in some of the blogs for diarrhea related dates, or some congenital anomalies they are getting detected more in some of the blogs. So I would like to know what is affecting the implementation of the various interventions government has been designed. So for that matter, I have joined this course to learn the qualitative research related activities.
What are you planning to focus on?
I'm trying to conduct one research on engaging the mothers, what affecting their understanding, and what is the role of traditional reach outs to the mothers' interventions for childhood illnesses. Probably I will do in-depth interviews or focus group discussions.
Through PHC, you'll do?
Yeah, sir. Yeah, ma'am.
Identify the sample through primary health centers and help.
Yeah.
Which state you are currently located?
I'm from Maharashtra, ma'am, and
Okay.
working in Nanded district.
Okay. Yeah.
Okay.
Yeah.
Thank you,
Maharashtra
Shivshakti.
also has health post, no, in the community. We also
Yes.
have a health post along with primary health center.
No, ma'am.
You don't have in Bombay?
Urban centers,
Yeah.
there are health posts, not in rural
Yeah.
area per se. In
Okay.
rural area, there is a structure is that sub-centers, and then primary health centers, and then rural hospitals, and sub-district hospital, then district hospital. And for urban health centers, there are some health posts have been created. And now this all has been converted into urban SWCs.
So your focus will be on rural.
Rural, ma'am.
Like this. Okay. Thank you. Yes,
Yeah.
fine.
Thank you. Shobna Prasadji, you can go ahead.
Good evening, everyone. Hope I'm audible, ma'am.
Yes.
Yeah. I'm Shobna. I'm from Chennai, actually. I'm a research assistant. I have completed my MPhil in political science. I recently concluded my one-year project with ICSSR. My project was a policy-based research where I conducted field work, and I specialized in policy studies with focus on rural-urban divide and their impact in migration. So to specifically say, I worked on SPMRM policy. It is a central government policy which focuses on migration patterns in rural areas, and why do they migrate, and what are the reasons, and what could be possibly done to stop that migration, and stop the urban overcrowding. In this fellowship, I really wanted to learn more on field-based research and skills needed to make it more effective. Actually, being on field, I've faced some practical difficulties where I needed much more guidance to streamline it much better and make those time more effective and more valuable, and draft better papers. That's the reason I've enrolled in this, ma'am. Thank you.
For this fellowship, what will be the topic of your inquiry?
Ma'am, I'm actually trying to focus on policy studies only, like maybe take any other policy, a central government policy, or maybe perhaps take from my own state and see its impact on various social issues. Like now I have dealt with migration I don't know which social impact I'm going to focus on next, but it will be related to policy studies only, ma'am.
So can you just see, because there is not much research on the gender minorities. So the policies of Tamil Nadu government is always emulated as a best practice so far as the transgender persons are concerned. There is not much knowledge in rest of India. So if
Okay.
you can,
Sure,
that's
ma'am.
just
Sure,
a
ma'am.
suggestion.
Sure, ma'am. Sure,
It
ma'am.
is still an under-researched area.
Yes, ma'am. Yeah, sure, ma'am.
Thank you, Shobna ji. Punya Rajput ji, would you like to go ahead next?
Yes, thank you so much. Am I audible?
Yes.
Oh, thank you. Good evening. I am Punya, and I recently completed my master's in education policy, and that has usually been my background. Education, and within education, I've focused on gender. And that is also something that I would want to explore further, especially with the national education policy and its focus on gender sensitivity. So I would want to look at that and how intersectionality was just mentioned during today's presentation as well. So I think how intersectional marginalization, I just want to look at the implementation of NEP and what that would mean from an intersectional feminist perspective. Yes. Yeah, that's all from my end. Thank you.
Yeah. Have you started working on it? Have you related literature?
Yes, ma'am. But I think I would love to explore more. I think I was looking at gender very generally and very broadly, but I think I would want to look at more specific and maybe I think more regional, because a very broad thing might just take it everywhere. So what region I want to focus on, I think I'll have to look at that more.
Where are you currently? Currently, where are you?
I'm in London right now, but I'll be coming back to Delhi. I'm based in Delhi. Thanks.
Thank you so much. Kinnori ji, would you like to go ahead?
Yes, ma'am. Thank you. Good evening, everyone. Good evening, ma'am. Am I audible?
Yes.
Okay. I am Kinnori Sinha. I am a PhD scholar from Indian Institute of Foreign Trade, Kolkata. So I have just completed my coursework, and my synopsis defense is yet to be done. So my subject area is actually economics, but my research interest is in forest management and forest conservation. So what I would like to see is that joint forest management as a policy was successful in pen and paper, right? With all the agendas being ticked off. But now what I feel is that we need to take a step ahead, where I would like to see whether the perception of so-called development has changed, or what is the true what do they think of development as a whole amongst the forest dwellers, and specifically the marginalized forest dwellers. Because I have done a pre-pilot kind of a visit to Sundarban area, and what I have found that uh, the marginalized forest dwellers are still not quite aware of their rights, especially after the Forest Right Act of 2006. So that is something which I would like to capture, because I think that there is a literature gap in identifying those. So my area would be evaluation of joint forest management, but in some other light. Ma'am, that's all.
Because in joint forest management, women have a pivotal role to play.
Yes,
So
yes.
are they just a nominal presence, or they have a real presence in your region?
Ma'am, I think it is nominal. I don't think so it is real. Well, I had only one interaction, and what I understood is that the reports are quite misreported, or underreported or quite far away from the reality. So that's it. So I really don't know how to do the qualitative research part. I would like to learn it from this course. I hope to learn it from here. Thank you, ma'am.
Thank you, Kinnauriji. Would anybody else like to go ahead? Um, we yes.
Ma'am, meanwhile, I just want to ask one question.
Yes, please go
Can I
ahead.
go ahead? We know the original article writing methodology, but I don't know about the research essays, how to write and that, because it's new to me. So that's why I asked.
See, in the research essays, when you introduce your topic, after that you also do the literature scan and do the gap analysis. That so far all those researches and publications that you have gone through, whether officially or by the independent scholars or any institute think tanks, what are the gaps in the research? And then you also arrive at your research objective. That is a third element. After that, you also tell the research questions, and then you come up with the research methodology, and then you go into the findings and the go to. So this is the systematic way, the structure in which you have to write. And I think even in the IMPRI's booklet that is there, that it is very different from the journalistic article. There is a certain system and step by step you have to go for your research. After your findings from the research, you also go into the discussion, the issues that arise from these findings, and then you have a summary, conclusion, and recommendations that emerge from the research. You can also give an idea about future such endeavors. What are the aspects which can be probed for by the future researchers?
Okay. Thank you, ma'am.
Thank you. Prashiji, would you like to go ahead?
Yeah. So, good evening, everyone. Good evening, ma'am.
Good evening.
So my
Good
name is Prashik, and I'm currently pursuing my master's degree in material science and engineering at Imperial College London. And my academics interest, although it lies in technical domain, but like my professional interest is lies in sustainability and governance, economic policy, and management. So I'm passionate about exploring innovative policy solutions to address contemporary challenges, and I look forward to engaging with all of you today. And yeah, like having a background in socio-economic, like political, from my family, and I come from the state of Maharashtra. So I'm from the city, like central India, Nagpur. So I mean, I'm just interested in learning qualitative research and public policy, everything. I'm just looking forward to it. Thank you so much.
Thank you, Prashiji. Would anybody else like to go ahead? We do have a couple of people still left. Ananda ji, Dada Das ji, Bruno, and I think Suraj Goswami. Would any of you like to go ahead?
Am I
Hi,
audible?
Dada here. Hello.
Yes. I
Yeah.
think Bruno can go first, and then we can go with Dada's ji.
Yeah, sure.
Okay. Bruno, please go ahead.
Yeah. Hi, hello. So this is Bruno Richardson. I'm from Chennai. I'm currently working as a research associate. So basically, we work a lot on quantitative data, like working with government and other NGOs and everything. So recently, I've been working with the public distribution system in Kerala actually. So we are just trying to identify about the distribution practice in Kerala, so about the type of rice they distribute in the ration shops. So these kind of data we are trying to understand. So since I've been like mostly working with quantitative data, I'm just a little bit curious on and really wanted to understand like how we use our fieldwork and for doing like qualitative research, because I also been recently started working on a like I don't say I really conceptualize the idea of my research ideas. Like, but I want to work on the workplace harassment in unorganized sector, because like we have a lot of papers on working in the organized sector. Like they also have some kind of setup on ICC, internal complaints. But when it comes to the unorganized sector, like it is really, I think that's something like not really, like most of the attention has been directed towards it. So this is something that I want to work. I think like qualitative research might be very impactful on these topics. So that is the reason like I just want to enroll in this and work on my research.
So are you in a trade union?
No, ma'am. So I worked in a research firm called JPAL actually. But previously, I've been working with a lot of trade unions in Chennai and out of like other districts in Madurai, southern part.
Yeah, yeah, correct. Thank you. It's very important. Very good.
Thank you so much, Mr. Bruno. And Dadasji, would you like to go ahead?
Yeah, hi. Myself Dadadas. I'm from Maharashtra, and doing my PhD from Tata Institute of Social Sciences, focusing on pastoralism in Himalayan region, study of Changpa community in Ladakh, and so that is my PhD work. And for this course, I would like to focus on the impact of climate change on pastoralist of Maharashtra, with special reference to Dhangal community in Ahmednagar districts, where I wish to understand what are how communities living with climate change, and how state is responding to the same. And so I'll carry research on the same. That's it.
So your fieldwork will be in Ladakh, no?
No, my PhD is on Ladakh. My fieldwork is
Achha.
will be in Maharashtra.
Maharashtra.
Yeah.
Yes.
Thank you so much. Suraj Goswami ji, would you like to go ahead? Yes, you are unmute, but we can't hear you. You can type in the chat box if the issue persists. You can type your introduction in the chat box. Ma'am, we have 2-3 people who have introduced themselves in the chat box. I'll just read aloud on their behalf. I'll be starting with Santushti Tyagi ji. She says, hello everyone, feel grateful to be a part of this cohort. I feel overwhelmed to be here with experts and professionals. A little about myself. I am a final year UG student at the University of Delhi. I am pursuing a bachelor's degree, majoring in nutrition and health education with a minor in entrepreneurship. I am an athlete, writer, and a social entrepreneur. About my research topic, I have tried to align the field policy making with my core area of study, that is nutrition and health. Therefore, I have decided to research on the impact of health policies on the women belonging to the lower economic strata. Why did I apply for the fellowship? I have been self-driven to work in the social sector. I have worked for my non-profit organization at grassroots level for over 2 years. It gave me a better understanding of what I want to do further. Secondly, I look forward to pursuing a career in public policy making and governance. And I thought that this fellowship would be a start into building it. So that was Santushtiji's introduction for us. I'll go ahead with Janviji's, or do you have some remarks for Santushti? I'll go ahead with Janviji's then. Janviji has done MA in Development Studies, currently working with Piramal Foundation as a consultant with the Health Department, Government of Bihar. She says that she works on implementing various government health programs and would like to pursue research in the adoption of digital solutions for public health delivery systems. Looking forward to the course, and followed by a thank you. Last, we have Anand Kumarji, and he says greetings from Bangladesh. He works as a humanitarian professional at Rohingya refugee crisis in Bangladesh at BRAC. Currently, he's traveling and finds it tough to talk. And the research interest area is climate change and child protection, how the government role to create a meaningful step. That's all, ma'am. That's all for the participants present today. Thank you so much. Yes, over to Dipangshi. We'll go for Vibhuti ma'am's final remarks for this inaugural day, and then we'll proceed with the final vote of thanks. So I invite Vibhuti ma'am. Over to you.
Yeah. We had a very rewarding session today when Dr. Padma Deosthali, who began with her research as a young researcher and got involved. All her research projects were on participatory action research, very demanding work that in the area of health expenditure, women's perception, gender-based violence, and also how the research translates into new structures and systems which are more empathetic to the marginalized sections, and also some of the legislations for which the researchers have played very important role. So the whole journey, we got a very good examples of so many case studies of how the idea translates into social transformation. We are going to have similarly in the next one, we will focus on the ethical dimensions. Again, Dr. Amarjit Sani will be talking about the consideration for ethics is extremely important in qualitative research. No harm to the respondents that is there. And one thing which is very important is our complete engrossment in the research process. That is the demand of qualitative research, because it cannot be outsourced. You are yourself involved. Some of the research reports which are made, especially during the pandemic, there were so many rapid assessment studies were done. Every day we used to get so many rapid. They were also based in a participatory. The people who were involved in the support work, in the running the community kitchen, or involved in the working with the bastis communities in terms of importance of vaccination or various kind of health-seeking behavior people had during the pandemic, they themselves were doing research. They were involved in support work. At the same time, they were also coming up with the reports which would be helpful to the system, to the government, in coming out with the new advisories, new rules, and especially when major reverse migration happened, where more than 3 crore people from the cities, urban centers of India went back to the native place and they were walking on the road. The report which came out, which is called Walking with the Migrants Beyond COVID, that was also excellent. That had used participatory action research methods. So while taking all the relief material like water, milk, food packets, children's necessity, chappals, umbrella, all in a vehicle, these researchers were walking with the migrants, and wherever they felt tired, they would sit and discuss, they would observe. So it is a participation observation. As Dr. Padma Deosthali said, that when they were asked to start a hospital-based support system for the survivors of violence, first 15 days, what the researchers did was just observe how the officers in the hospital system or the professionals in the office, with right from doctor to nurses and ayabais and helpers and liftmen and watchmen, they respond to those women who come to the emergency ward with bodily injury. And that the tone in which, in fact, for us also, it was in the 80s when in Sion Hospital, every day like 3 burn victims used to come in the casualty ward. And we started working. Our experience was they were directly approaching women's organization because they had no faith in the system. But burn victims, their relatives used to come to us, and what we saw when we went to burn wards, the way insensitivity with which medical social workers, psychiatric social workers, police, and the doctors were treating these burn victims. Police would be actually threatening them that don't give your die. In any case, you are going to die. Why do you want to blame your husband? Don't you know you are a married Hindu woman? Your husband is he's your God for 7 lives. How can you blame him? And they would force that lady to say that it was an accidental death. No, it was accidental injury, not premeditated murder. We reported to the Bombay police commissioner, that this is what is happening at a ground level, and our research is showing that this is a very inhuman way in which women in casualty ward are treated, and that resulted in a women and Bombay police working together and coming up with the new protocols for the dying declaration. And we were asked to give one representative from women's organization should be there when the dying declaration is given. Similarly, after the gang rape of an intern who had gone to the field work and she was raped in a Shakti mill, Bombay police and the women's organization came together. They recruited NSS students of all the colleges from Bombay University to do the safety audit of the city. That was also part of participatory research method, that the students went there accompanied by the NSS coordinator, teachers, something this thing. They went in a group and they saw what are the unsafe places in the city. And they spoke to the local people. They spoke to the women, children, elderly people. And from on the basis of that, the safety audit was done. Similarly, Jaguri has done similar participatory research in the city of Delhi after Nirbhaya tragedy. So I think it is a very important tool to bring so many better quality of life to the community, better intervention strategies for the state and non-state actors. And also it's a very, the whole process is so empowering that we are not mere spectator. When there's so many things are happening around us, we can shape the world the way we want, and we can put our heads together. It is not my way or highway, but all of us, all the stakeholders come together and generate new knowledge, and based on that, new praxis, because praxis is different from practice. Practice is a mechanical thing. Praxis is that you have a knowledge on the basis of which you decide what kind of intervention strategy or what kind of short-term strategies or what type of policies and what type of legislations you need to you need to come up with. So I think Dr. Padma Deosthali has explained to us in a very concrete way, because all her life she has worked at a grounded, has done the grounded research, and she has also been very much a community-based organizer, and that has helped us to understand the connection between research and social transformation. Thank you very much.
Thank you, ma'am, for your remarks. As we come to the end of day one of Public Policy Qualitative Participatory Action Research Fieldwork Fellowship Cohort 5.0, an online national winter and spring school program, a 5-month online immersive qualitative participatory action research fieldwork certificate training fellowship, I, Dipangshi, researcher at IMPRI, Impact and Policy Research Institute, would like to propose the formal vote of thanks on behalf of IMPRI, New Delhi. We are grateful to our chair, Professor Vibhuti Patel, an expert of the day one session, Dr. Padma Deosthali, for taking out their valuable time and for their thought-provoking insights on the topics. We thank all our participants who have raised pertinent questions and actively participated in today's deliberations. Readings of the sessions have been shared in your email, and a video of the session will also be shared with you for learning. We look forward to welcoming you for a second day of this fellowship on 25th January at 3 p.m. for a session with Dr. Amar Jasani and Dr. B. Rajeshwari. We are grateful if you are watching us later on YouTube or listening to us on various podcasts or reading our publications. We hope you continue to join in the future IMPRI Web Policy Talk and Web Policy Learning. Wishing you a good evening. Thank you.
Thank you, Dipangshi, for moderating the session so well. That's good.
Thank you.
Thank you.